we have no COI to disclose. Now, we usually do two common instrumental soldering examinations, freeze and VFSS. Regarding freeze, we can evaluate the pharyngeal lumen via endoscopy. Vocal cord mobility and laryngeal sensation can be also evaluated. However, it is unable to assess the pharynx at the moment of swallowing. As for VFSS, we can assess the swallowing function from the mouth to the esophagus in lower anteroposterior views. But this test has a problem of radiation exposure. We have been thinking that for more detailed understanding of swallowing dynamics, three-dimensional assessment is ideal. For better understanding three-dimensional swallowing dynamics, we combine the spatial components of the CT images with the temporal component. As a result, we succeeded in creating a four-dimensional movie by continuously playing back these 3D images. Thus, this is swallowing for the CT. Here are examples of lateral and frontal swallowing CT. You can see the pharyngeal lumen in blue and contrast agent in pink. The depiction of the swallowing CT is very clear and beautiful. However, it is not all good. There are also some challenges. It takes a relatively long time for image reconstruction. Despite that, reconstructed images are displayed in 2D. The cost of a dedicated workstation is so high. To solve this problem, we try to find an application of virtual reality to swallowing CT. When virtual reality images are reconstructed from the DICOM data of a static CT image, we can see it here with a virtual reality headset. If we use this depiction method for continuous images at multiple times, we can see continuous VR movie via headset. Therefore, we examine whether the following three items are achievable. First, 3D display for easy understanding of structure changes. Second, reducing the time for image reconstruction. And third, cost reduction. Regarding rendering setting of VR, we went through a lot of trial and error, and finally came up with the descriptive conditions. The 3D models were reconstructed from CT image data of DICOM format using the matching cubes algorithm. For mucosal surfaces, the CT value threshold was set at 350 Hounsfield unit. The 3D image is rendered as semi-transparent by setting the alpha value to 80. For bone tissue, the 3D value threshold was set at 300 Hounsfield unit, and the image is rendered as opaque display. Superimposing pharyngeal lumen models and bone tissue models made it possible to simultaneously observe the dynamics of the pharyngeal lumen and bone tissue during swallowing. Since the CT value of the contrast agent bone tissues are comparable, we abandoned the extraction of the contrast agent only, because it requires manual work and huge amount of time. This is a reconstructed image of mucosal surface. And the next one is a reconstructed image of bone tissue. Superimposing them, you can see the bone structures in the same view. We programmed the optimal setting conditions for VR images and automated the process of displaying VR images from DICOM data of swallowing CT. In addition, as innovations in displaying the VR images, we have added the following function to this VR system. Those can be operated with two-hand controls. I show zoom in and out function here. Then I can freely rotate and move the object like this. Doesn't it cool? Moreover, I can adjust the playback speed. I can also pause the movie. This VR system can provide a 3D display that facilitates the visual understanding of 3D structure changes. Cost reduction is one of the most important issues for the convenience of Swarming City and VR. We compare the time to reconstruct 3D images using data from 5 cases. Compared to conventional Swarming City, our VR system could reduce the time for image reconstruction. Comparing the cost of the equipment, the cost of the VR system was much less than that of the workstation for the Swarming CT, a tenth of the cost. However, there are some following limitations of Swarming CT and VR. Need of dedicated CT scanning equipment, radiation exposure, restriction on posture, difficult to perform multiple examinations, and not suitable for assessment or aspiration. So, we think that the most effective use is to complement the information obtained from general swallowing examinations. Discussion. In swallowing VR, four-dimensional swallowing dynamics are immediately visualized by reconstructing sequential images using a self-developed software program. Swallowing VR system makes it possible to visualize the invisible in swallowing management. Moreover, this novel imaging method is anticipated to be applied to an education program of swallowing. For example, for understanding the normal structure changes during swallowing, or for utilization as digit atlas library of swallowing VR. Elderly person, stroke person, a patient with vocal cord palsy, ALS, Parkinson's disease. This is a summary slide. We developed a platform to display swallowing CT data in VR, which can visualize the 3D structure changes during swallowing. Swallowing VR system shortens the time required for 3D image reconstruction and also reduced cost. It's anticipated that swallowing VR will be widely used to be a role of visualizing the invisible. Thank you very much for your attention.